What's going on, guys? It's the Psych NP. Sorry I've been busy. I know that I always say, guys, I've been busy. I haven't posted a video in 3 or 4 months, but I started my DNP program, still working the private practice life. But guys, this is Ariels. She is a new graduate Psych NP, and she's been working with me for 2 or 3 months now. She's doing great. She's going to definitely be in a lot of my videos going forward. She's also starting a YouTube channel. The link will be in the description below. And let's get to it. So today, guys, we're going to be talking about do you need Psych RN experience prior to becoming a Psych NP? I think a lot of us talk about you definitely need it. There's no ifs, ands, or buts about it. But Ariel is actually someone that doesn't have Psych RN experience, and she kind of changed my mind and swayed my mind in terms of this kind of topic. All right, guys, let's get to it. So today we're going to be talking about, do you need Psych RN experience to become a Psych NP? So Ariel, I kind of introduced you earlier. She doesn't have Psych RN experience, but she is a new grad Psych NP working with me, and she's doing amazing. So Ariel, tell them a little bit about your journey into becoming a Psych NP, and how did you choose this job role? Because I know you worked in ICU before.
Yeah. So I've been a nurse probably going on almost 8 years, I believe. And I started my journey technically in like the mother baby unit as a secretary, and I knew that wasn't for me, so I moved on, and eventually I went to the ICU. I always had a passion for mental health because I have my mom who is diagnosed bipolar. She went through, during my time in nursing school to out of nursing school, she went through a very rough patch for probably 3 to 4 years, with multiple suicide attempts, multiple inpatient psych admissions. I think I've seen the inside of 15 psych units in the state I live in. I don't even know if there's that many, but I've seen a lot. But following her journey and wanting to get her help, and feeling like there was a lack of help. Saw a lot of psychiatrists outpatient. They spend like 5 minutes,
Maybe 2 or 3 minutes.
Yeah, probably 2 to 3 minutes with her, and just it was difficult. So my passion though it had started to lie there because that's where it started. But I did do ICU for many years, probably been 4 years of critical care exactly. And we see people at their lowest. It's not inpatient psych, obviously, but we do see a lot of comorbidities with psych problems too. So we get a lot of suicide attempts, a lot of overdoses, a lot of alcohol withdrawal, and a lot of people just chronically mentally ill, or not chronically mentally ill, but chronic illnesses that are depressed or having other problems because of these illnesses. And we can see them at their worst times. Not only that, but the families, if you have a dying loved one in the ICU. So there's a lot of psych in an ICU, there really is. Mm-hmm. It's not inpatient psych, of course. And, when I went to school to become a psychiatric nurse practitioner, I was nervous. I didn't know if I would like it, honestly. I knew I had a passion for mental health, but I was terrified that since I don't have any inpatient psych experience, what am I, am I really cut out for this? But after my first clinical, I knew this is where I belonged, and I knew that I cared. It's not about anything else, but I just want to help people. And I think we'll talk about, inpatient psych nursing versus being a Psych NP.
Yeah. I think, guys, like what Ariel was saying was the passion for mental health. If you don't have that passion, it's really difficult to get to any field, but especially psych. You guys see people at their worst, and it can be a very emotionally and physically draining for us as providers, because we take a lot of stuff home, even though we try not to. We get the emails, we get the phone calls from the clients, even on our off hours. And this job is very difficult. And that's kind of why when I did a video recently before with some other Psych NPs talking about do we recommend psych experience before becoming a Psych NP? And I think it's still really important no matter what, just because, how will you know you're going to like working in psych if you never worked in psych? And it's definitely something that, it's important, but it's not the end all be all. Because before I hired Ariel to work with me, and she's been doing such an amazing job. But she actually didn't have any Psych RN experience. And the reason why I picked Ariel is, I did an interview with her, and she said, she told me, about her mom and her passion for mental health and how much it meant to her, and I previously also worked in the ICU as well, even though I did also work in inpatient psych later on. I see, ICU is still a very good, learning the medical things, being able to understand labs, these kind of things, it helps in psych.
Yeah.
But, it's tough because, a lot of people don't get a chance if, they don't have psych experience. Because, when I did a job posting, I had probably 50 applicants. And one of the big things I looked for was psych experience, right? And that was one of the biggest things. And a lot of people didn't have it, and the thing is, to make your resume more competitive, it definitely helps to have psych experience because, how can you stand out? Did you work as a clinical instructor in psych? Or, again, do you have inpatient psych or any kind of psych experience? So that definitely sets you ahead of other people because it kind of shows, okay, this person has worked there and maybe they have a passion for it. But then there's the other cases, like maybe they have worked in inpatient psych and maybe they don't have a passion for it, maybe they're burnt out. But Ariel's been, she's definitely swayed me in terms of, you don't need psych experience, but I just think you definitely need the passion for it.
Yeah, I agree.
What do you think, Ariel? You've been doing this now for a couple of months, Psych NP, and I know it's a lot different of a job role than being an RN in ICU. But what do you think? Like the transition about it, like has it been difficult? Like what do you like about it? What don't you like about it?
It's definitely difficult going from a bedside nurse to a provider. I think any transition, even if I were a Psych RN going to a Psych NP, that's a transition.
Sure.
You're the one making the medication decisions. You're the one prescribing these medications. It's a transition that, nurses were not used to. We're used to going to somebody else, and now you're that go-to person. So that transition itself has been uncomfortable at times, because,
Sure.
I don't want to hurt anybody, and I want to make the right decisions, and if somebody comes back to me in 2 weeks and they're worse, I feel like it's my fault, even though I know it's not my fault. It's just the illness that, they're dealing with, and maybe it's not the right medication, or maybe it's not been enough time. 2 weeks isn't long for a medication, of course, but you still want to see some progress after 2 weeks sometimes. It just makes,
Right.
You want your patients to feel better. So that's been, that part is difficult. Answering emails on your days off, getting phone calls on your days off. It's not that it's annoying that happens. It's more, if you're getting these calls, it's because something's wrong, and that's concerning. So at the hospital, I work 12 hours. You go in, you leave, and then you're done. Here I work, my days, but I have to have my phone on me at all times just in case there's anything going on. And obviously there's a time frame. I can, I don't have to respond to people right away, but I like to as fast as I can. So that transition has been different. But as far as, I feel like I'm happy here. I'm doing what I wanted to do. When I have a patient come in and tell me that they're better, or if I see somebody who was apprehensive to going on medication, and I, was able to talk to them and get them through it and go on, and then they message me and say, hey, I just want you to know I'm doing really well, and I'm really glad I took your advice. That's why I'm doing this. That's what I want. I want to help people, and I love that aspect. And I feel like you do have to have that passion, because it's not just a job. It's, this is important work. It's not, you're helping people, and helping them is everything to them, because this could be, literally it could be life or death. If you have a patient who's on the verge of suicide or anything like that, this is a life or death job. Yeah.
My biggest fear was when I was a psych RN, I was burnt out from inpatient psych. Guys, I worked in Baltimore. I've been hit in the face. I've had so many bruises in my face, guys, from getting punched in the face. And I know it comes with the territory, and I know these people are sick, right? But I was just so tired of it, and going to Psych NP school, I was like, am I going to like this? I know inpatient psych is obviously different than outpatient, right? But I never worked in outpatient psych. I didn't even know there was jobs in outpatient psych that I could get as an RN. And that was, I was worried. And when I became a Psych NP and I was doing clinicals there, I really enjoyed it. Mm-hmm. But a lot of my preceptors were burnt out. They weren't happy. And I don't know if it was because maybe, they didn't have a passion for it. Maybe it just, the job is very stressful. And that's why we stress you need a passion for mental health.
Right.
But I was worried when I graduated, will I like this job? You know, will I be happy? And like that's like the one thing that, you know, obviously for anybody, you just want to be happy with your job. Like the grass isn't always greener, but I knew that if I stayed as an RN in inpatient psych, I would be burnt out within like the next couple of years.
Yeah.
You know, and being a Psych NP so far, it's been great. I've only been doing it now I graduated 2019, started in July 2019. So it's been more than 2 years, 2.5 years or something around that. And I still like it. And that's the one thing, like my biggest fear is getting burnt out and not like, you know, not being as empathetic as I once was, you know, like, because right now, like I love taking care of patients. It's like, it means a lot to me. Like what Ariel said, when your patients tell you like, I'm feeling better, and it was a decision that you made. And the thing is, we empower these people, right? You know, the medications are only 20-25% of what it does, but you empower these people to, you know, live the life that they deserve. And everyone deserves that. And you kind of give people their life back. And when you can do that, it's like the most fulfilling thing in the world. And I think, you know, people understate that, you know, they think, oh, going to the Psych NP field, you'll make a lot of money. Sure, you can do pretty good with money. But it's like, you know, we have such a responsibility that we get, and it means the world to us. And I don't think Ariel or I will ever take it lightly. And like for us in our practice, like, you know, everyone genuinely cares about patients, and that's the main thing. And, you know, it's such a transition going from the RN to NP role. Like Ariel knows it. I remember being a new grad, how hard it was, like trying like to, you know, I don't want to screw up. Like it's like the hardest, you know, like Ariel gets an email and she, you know, she worries about it. I remember too, I was like, man, like what am I doing wrong? Am I like, did I choose the wrong medication? Like what should I do? But the thing is, in outpatient, you know, you can't really check, you know, like you only see them every 2 weeks or every 3 weeks. You know, it's not inpatient where you can kind of do something and you can assess the change the next day. It's just, it doesn't work like that. But, you know, Ariel definitely changed my mind about, you know, not having RN experience as a psych nurse. Because while it does help, you know, you learn about the involuntary side, the voluntary side, and you get to see these psych meds like firsthand.
Right.
You get to see the effect, and like, you know, I remember, inpatient, so you see a lot of the antipsychotics. You give a lot of the IM shots. You give a lot of the things that, you know, you see the seclusion rooms, the restraints. You know, I know you see it in the ICU too, but knowing how like these court hearings go, knowing about really the whole system, how the social work team tries to get patients to an outpatient setting or whatever setting they're going to go to. So it definitely gives you like that firsthand view, and it definitely helped me, become a pretty good Psych NP. But I still think their Psych NP clinical rotations is probably the most important part. And I always tell people not to take that lightly, because that's where you learn. There's no pressure. Yeah. You can really become the best Psych NP you can be. Because once you graduate and you're out there, you know, it's of course it's not easy, but, you know, do you have a mentor? Do you have someone that can help you? You know, because you're not going to know anything, you know, or everything. You know, even 2 years in, you know, I still sometimes have to ask people for help, right? Because you'll never know everything. But, you know, Ariel is like kind of taking and ran with it. You know, she's been doing it for 2 or 3 months now, and she's doing an amazing job. You know, and you can tell she genuinely cares about people, and it shows. You know, her patients love her. You know, at the beginning, Ariel was kind of, you know, she'd probably ask me questions, maybe 100 questions a day, but now it's down to like 10. So, you know, she's doing so good. Ariel, what do you think? I mean, you've been working here now, like, do you feel like you're happy making a decision going to Psych NP versus, I know you're still working as an ICU nurse at this time, but yeah. What do you think?
I'm very happy with my decision. I think I'm learning as it goes, and, you know, you're in school and you learn so much in school, but it's different when you're the one giving the medications, you're the one making the actual changes. Of course, when you're doing your clinicals, you can have suggestions, or you can even be the one telling, you know, your instructor, this is what I would want to do, and they may agree with you, but really now it's all on you, and I can't go to him every single, I mean, I can if I wanted to, but I don't. With every single patient, I try to, you know, use my best judgment, and then I realize that, you know, sometimes it's not going to work for everyone, and I know I've been to him for a few cases that I'm like, I just don't understand why they're not getting better, and, you know, I've talked to him, and he said, you know, I probably wouldn't do anything different than you're doing, you know, sometimes it just takes time, and, you know, I think we learn in school with antidepressants, it takes 4 to 6 weeks to really kick in. And we know that, but when you see somebody who's really struggling, it's like, feels like you don't have that time to wait, and it's sometimes that can be difficult. And, you know, not seeing any improvements right away, I think that's difficult, because, you know, this is a pretty rewarding, I feel like a lot of I think I've had some pretty easy patients, thankfully, and they get better quickly, which is wonderful. When those that don't, that's when I struggle. But I know that's part of the process. So I think that's the hardest part for me, and that's definitely, I'm learning that not everybody's going to get better right away. And I do think that it is different than inpatient. I think if you come at it from both sides of saying you need psych experience to be a Psych NP, but really outpatient is so much different than inpatient. You do get to see that side of things, but you don't, you get to, like, when you're inpatient, I'm assuming I know they can be more judicious with giving medications at higher doses because you can watch side effects more, whereas outpatient, we have to, start low and go slow because you don't want side effects, where I've heard of, like, psychiatrists starting, like, high and then going down because you're inpatient, and I don't know how true that is, but because I've never been inpatient, but...
Yeah, it's definitely a different world, inpatient versus outpatient. I think one big benefit from working in inpatient psych would be communication, right? Like, I know the ICU, like, for the most part, whether they're intubated or sometimes you can talk to them, but then you have to do assessments with all your clients, right? So in inpatient Psych RN, like, you're doing the assessment, you're trying to see, determine suicidality. Obviously diagnoses are probably already there, but you really have to do your own assessment on them. You see how they respond to medications. And I think when you do, as a Psych NP, when you're doing your assessment, your initial evaluation, or just even talking to someone, I think your skills are already strengthening, at least in communication. That would be probably the number one thing that I think you probably get from Psych RN experience. But that's probably the main thing, because like Ariel said, it's just different. This NP role is just completely different, and that's why Ariel's definitely changed my mind. I still recommend Psych RN experience, but you don't need it if you really have a passion for it.
Yeah, and well, like you said, it's good for your application because I did not know if I was going to find a job because of not having that, and that was like my biggest fear because I didn't have that Psych RN on my resume, and I didn't know if I would get interviews or how that was going to go because I had no ins in the psych world. I didn't really, since I work in the ICU, it's not that I could go to our inpatient psych unit and be like, hey, do you recommend anybody outpatient or can I work over here? Because they didn't know me. They didn't know my work ethic. They didn't know how my true passion was for psych. They just saw me as an ICU nurse going to Psych NP. And, a lot of people, I think 75% of people, if I say, yeah, I'm a Psych NP now, they say, oh, how much do you make? I'm like, that is not why I did this. And I think, some people, obviously, they go for the wrong reasons, but if that's the only reason that you're wanting to go for it, you have to have a passion. There's for sure needs to be a passion.
Yeah. The reason why I hired Ariel is because I had 3 or 4 clinical questions that I wanted all my potential people to answer, and Ariel answered all the questions right. She was actually one of the only 2 or 3 out of 50 applicants that answered every psych clinical question correctly. I think what was it, Ariel? It was about like sertraline versus
I think it was
fluoxetine or Lexapro. I forgot what it was. It was about activation. What would be better?
Prozac, yeah.
Yeah. So
what would be better for anxiety?
Yeah, and I had people that were Psych RNs that got that incorrect. So, and I just thought that was more of a basic question. But Ariel it was just easy for her. She was like, next. But yeah, guys, it's been an awesome time just to speak with you guys. We wanted to give you our experiences because Ariel comes from a different side than I did, but we're still similar because I still worked ICU, but like it's just there's benefits to both, and I think it's different, guys. But whatever way you choose, if you have a passion for it, go for it. And I think going forward, guys, if you have any other questions below that you want us to answer, Ariel's going to told you she's going to start her channel. It'll be in the link in the description below. But we like answering questions from you guys. It gives us something to do. When we have patients that no show. I know I suck with the content, guys, giving you guys very consistently. But Ariel will probably be a lot more consistent than I in terms of the content, hopefully. But
I gotta say one more thing. I'm way better of an ICU nurse than he is. I'm sure he is way better of a Psych RN than I am. But the Psych NP is still a debate. I got time to.
Yeah, Ariel's pretty good. I'm probably a low-tier Psych NP, but guys, I might not be the smartest, but I care the most. I tell you how much. All right, guys, the Psych NP out.